This is chapter 10, part 4. Let's continue talking about some of the various characteristics of treatment programs, and then we'll finish up the chapter with sort of what the research has to say about what kind of programs are most effective at treating cocaine abuse. Next point here, whether an inpatient or an outpatient basis is the one that's chosen for the person with the drug problem. There are several approaches for treatment. So I've kind of divided this up into two parts, going over these different types of programs, describing those, and then evaluating them. So there's a little bit of repetition here. It sounds like repetition, but heck, a little repetition never hurt anybody. It helps you to remember these programs and sort of what's effective. So one alternative is a self-help support group like Cocaine Anonymous, which is done in the traditional vein of the 12-step programs like Alcoholics Anonymous. So that's going to be your sort of least expensive, but also somewhat effective sort of program as well. So in this program, recovering cocaine abusers meet in group sessions, so they get together and have meetings with a group of people who are all struggling to one degree or another with this issue. They learn from the life experiences of the other members. Again, some people are doing well, some people are just starting and just beginning to try to quit, and so you have various people who share and gain a sense of accomplishment from remaining drug-free in an atmosphere of fellowship and mutual support. See, so this is one way you get around your bad peer environment, is instead of hanging out with all your drug addict friends, you come to these CA meetings, like AA meetings, and you're hanging out with people who indeed have a history of drug problems, but they're there because they want to quit, and so they're there to support each other, to encourage each other to share success stories or frustrations or difficulties. So it's sort of a replacement for the friendship issue we talked about before, because here you have folks who are trying to do the positive thing like you yourself are, so you're getting that mutual support. In another treatment option, cocaine abusers meet with cognitive behavioral therapists who teach them new ways of acting and thinking in response to their environment. I've stressed it in the past, I'll stress it again in this course, that a cognitive behavioral approach tends to be a very good one to deal with a range of psychological problems, including drug dependence, because they work on your perceptions, your attitudes, your values, your approach to things, that approaches, attitudes, values, which in the past have proven to be counterproductive, that have led you to the trouble you've gotten yourself in. So the idea is that if we can sort of reframe the way you look at things differently, different attitudes and different values, that leads to different behavior. So it's very much sort of evaluating maybe some of the ways that you think that aren't the best ways of thinking of things that maybe have been self-destructive in the past. During the course of cognitive behavioral therapy, cocaine abusers are urged to avoid situations that lead to drug use, recognize and change irrational thoughts. That's a key central part of cognitive behavioral therapy, CBT as it's called, to be able to cope in positive ways with negative emotions that we know are a big deal when you're talking about stopping cocaine use. And practice drug refusal skills. So there's a focus on skills to refuse drugs, to avoid drugs. It's skill-based, it's attitude-based, it's values-based, it's perception-based. While the success rate of both approaches are approximately the same for patients in cocaine abuse treatment overall, evidence suggests that treatments must be individualized to optimize outcomes. This is something you find in a lot of different areas of research, is that programs are usually designed one size fits all, one program for everybody, same program for everybody. It's assuming that everybody's the same. But reality is it's not true. We're all individuals. We're put together a little bit differently than our neighbor. And so everybody needs to have an individualized treatment approach, ideally, one that's kind of custom made for your particular self, your particular characteristics, to to have the best outcomes, to have the best results. Because again, one size does not fit all. Everybody is somewhat different, is somewhat unique. An intensive relearning process must occur because cocaine abusers often cannot remember a life without cocaine. Imagine that. Imagine being in a place where you can't even remember your life before you started abusing cocaine. That shows the powerful impact it has on a person's life. The potential for relapse is particularly challenging among recovering cocaine abusers, primarily as a result of powerful conditioned cues that have been associated with the drug. So again, because the negatives are so strong, the negatives of addiction, it's really hard to beat. There's just a lot of things working against you. Now, that's just to lay out a description of briefly of different kinds of treatments. Now, what does the research say about effectiveness? Because that's bottom line with this stuff, is what works, what doesn't work. Now, so according to research, there are several effective treatments for cocaine abuse and addiction, though no single treatment is universally effective. Okay, with a lot of this stuff, you get a certain percentage of folks who will be able to beat the drug problem. Might take them a couple of times, a couple of relapses, but there's no 100% cure, obviously, for anybody who has any knowledge of this kind of stuff. We're talking here about a certain percentage of people who are successful, certainly not everybody. The most common and evidence-based approaches include the following. Number one, behavioral counseling and therapy. So we kind of talked about this cognitive behavioral therapy, CBT, which we know that it helps change the patient's expectations and behaviors related to drug use and to increase coping skills. So it's about expectations, beliefs, attitudes, values, and developing coping skills. It's very practical. Contingency management uses a voucher-based system to reinforce abstinence. So it's kind of a reward punishment. Contingency management is kind of a reward punishment. Do good behavior working towards beating the drug, you get rewards. You get a voucher-based system. So the voucher is attached to certain kinds of rewards. And if you're behaving poorly and you're not working towards your goals of breaking the habit, then you don't get vouchers. You don't get rewards. You get rewards withheld, which is a form of like punishment. You're not getting what you're shooting for. So it's kind of a, long story short, kind of a rewards punishment approach. Motivational interviewing helps resolve ambivalence, meaning mixed feelings about quitting the cocaine, and to motivate people towards behavioral change. In particular, the way that they motivate you is they help you find the reasons within yourself that motivates you to quit. Not why I think you should quit, not why I would be motivated to quit, but the question is what motivates you to quit? What inside of you do you really care about? And so it's trying to help you discover within you where that motivation is going to come from that you need to be able to make the changes. Okay, number two, medications. As we saw with opioids, it's not just a behavioral therapeutic kind of approach. Let's talk through your problems, but also medications can alleviate the negative symptoms, can block the cravings, that sort of stuff. But currently, there's no specific medications approved by the FDA specifically for the treatment of cocaine addiction. So we don't have, what does that mean? We don't have a situation where there's one specific drug that has been proven to be effective for certain sorts of problems, cocaine related problems. And so you'll get physicians, you get people who are prescribing these drugs who will prescribe different things that will work for different people in different situations, but they don't really have there's a couple of drugs that we could talk about. We won't get into that. So we still have a long way to go to come up with more specific recommended prescriptions, right? However, some medications may help manage withdrawal symptoms. See, and that's what they'll use. They do stuff to make you feel not so bad when you're dropping cocaine, when you're giving it up. So they'll reduce the withdrawal symptoms or other conditions like depression that come along with giving up the drug. So they'll address those symptoms. People in everyday life have depression. People in everyday life have anxiety. They have these symptoms that are not coming from off the drug but have other sources. But you can use a lot of the same drugs to reduce those symptoms. So in examples of the type of drugs that might be used: antidepressants to address the depression issue, anti-anxiety medications to address the nervousness, the anxiousness, the worrying, all that, the stressing out stuff, and medications for other substance use disorders. So again, the doctors have experience with this, and they'll try out different things if they think they're going to work, and they'll see how you go when you try out this, that, or the other. Number 3, residential and outpatient treatment programs. Inpatient or residential treatment provides intensive, structured care and sober living environments. So residential and outpatient, so either living in a place or visiting in a place daily, have proven those both can be effective. All of these that I'm laying out here, medications, all of these have proven to have some effectiveness. So I'm not talking about anything that completely doesn't work. Outpatient treatment programs allow patients to attend counseling and therapy while living at home. Less expensive, less invasive, less intrusive in a person's life. Support groups, number 4. Groups like Cocaine Anonymous, which we've talked about before, that follow the 12-step model, provide peer support and also accountability, that when you screw up, you've got folks in the group, in the support group, who are going to get after you for not achieving your goals and for backsliding, for screwing up. So the accountability, we haven't really talked about that, but the most effective approach typically involves a combination of behavioral therapies, medication, if necessary, not everybody needs the medication, and continued monitoring and support, peer support, staff support, through inpatient or outpatient programs, and also the self-help group. So a lot of times a combination of these things, you can do some of these things together. And usually the more sophisticated approach, again, some of it's more individualized approach that I talk about, leads to more effective, more positive outcomes. So getting more things that you need is kind of, as you would expect, helps. Comprehensive treatment addresses the biological, psychological, and social aspects of addiction. Addiction isn't just one thing. It's different somewhat for each user, for each abuser. And so, but this comprehensive approach where you're using, not just medications or not just talking through problems, but a combination of those things, peer support things, multi-pronged, hit it from different angles, and each thing is going to do its own little part, and altogether you're going to maximize your chances of being able to beat this problem. So multi-pronged, hitting it all from all different ways that may be contributing to the problem, right? Fighting all of those on various fronts. And there we go. So that completes the chapter. Again, that was over 20 slides just talking about cocaine. So I'm going to ask you to kind of on your own to make sure and cover those same sorts of items on the meth problem. So of course, reach out. Let me know if you have any questions. If parts of the chapter are not clear or I can help with anything, just let me know.